My father is a small town dentist, and he is well known for weekend calls and home visits. He's very old-fashioned in the way that he cares for his patients. And I watched that my entire life. I saw him go the extra mile, and he was truly an advocate for his patients and a friend of his patients. He was much more of a partner in the health care of the patient. And so I think that's where I get my demeanor and my philosophy for treating a patient. My dad always wanted to go to medical school. He's a dentist, and actually, because of that, I think I never ever considered any other career, because he knew that I needed to be a doctor. And it isn't that he pushed me, but we have such similarities, and I watched how much he enjoyed his work, so I never really ever considered being anything other than a doctor. And as I see myself practice now, I giggle to myself a lot when I think that that's exactly what Dad would have done or said in that situation.
I love the looks of you, the lure of you, the sweet of you, the pure of you, the
I went to Dr. Sawyer basically from recommendations from friends, and I liked the idea of going to a female dermatologist. And once I went, I was totally sold on Sarah.
I met Dr. Sawyer. I was going to a different dermatologist, and I had a spot that needed to be lasered, and so she sent me to Dr. Sawyer because she had the most lasers of anyone in the state of Alabama, and fell in love with her and stayed with her ever since. She's brilliant at what she does. I have recommended lots of friends to go to her, and no one has ever been disappointed.
She listens to what you want, and then she makes suggestions. And based on her suggestions, I would ask questions, and then we would map out a plan. So I really feel completely comfortable with her, feel comfortable with whatever she recommends, and have been very, very satisfied with all of her recommendations and the final results.
I've been working in the cosmetic field for the last year, and so I have worked with Dr. Sawyer through that, and the more I have gotten to know her, first of all, she has the most pleasant, bubbly demeanor you've ever been around, so she's just really magnetic from that perspective. But the more I got to know her, and I realized what a great understanding she has of cosmetic dermatology, and even more than that, she has just an amazing eye. You know, I feel like she really has this ability to look at a face and kind of know what it needs. And so the more I got to know her and sort of realized her ability in that area, I couldn't resist. I had to come in and be one of her patients.
One of the best things that I most appreciate from Dr. Sawyer's office is the fact that she is very efficient. I work full-time, so if I am in her office, I'm normally there on a lunch hour or a break or between calls and between appointments. So if my appointment is at 10 a.m., I like to think that I'm going to get her to see her around then. And every time I've been in there, I just can't tell you enough how much I appreciate the fact that her staff, the entire office, is run with such efficiency, and they're very professional. And I never have to worry about being in there longer than I should.
Okay, I will. All right. Hi, good morning. Good morning. I'm Sarah Sawyer. Nice to meet you.
I think my philosophy when dealing with cosmetic procedures and cosmetic patients is that every individual requires their own plan.
I've Botox before, and I'm a little bit scared.
Most of the time, when you come to see a cosmetic dermatologist, You're looking to look the best that you can for your age. Being a cosmetic dermatologist, you're able to help people with their skin more than any other specialty. So I first learned what diseases of the skin look like and how to treat them. And then I took it a step further to learn how to best remove a skin cancer and preserve the cosmetic look and the function of the skin.
She does a really good job, so it helps make you feel more at ease in having, biopsies taken off to know that she's got a touch, especially being a woman, to keep that skin looking pretty.
My mother came in purely for cosmetic purposes, but while she was there, Dr. Sawyer was looking at her from a medical perspective too, and actually saw a spot on her face that needed to be biopsied, and she was able to do that and stitch it up in a way that no one would ever know that she'd had something biopsied on her face. And it was really just a great overall care that was given. So she took care of the cosmetic needs that she came in for, but then also took care of the medical needs that were there. And it's reasons like that I would feel so confident about telling any of my friends or family, it's worth the plane ticket. If you have to fly in to see her, it's worth the drive. It's worth whatever you have to do, because she really cares about her patients and takes care of anything she sees that needs taken care of.
6 months prior to my meeting Dr. Sawyer, I'd had an emergency surgery, GI surgery, and in the recovery period had lost a significant amount of weight. In the process of gaining that weight back, there were a lot of areas in my face that the weight just didn't come back, and the good weight, the weight in your face that makes you look young. And so I was left being very drawn looking and tired and gaunt. And so Dr. Sawyer recommended Sculptra, and she said that what that product does is it's natural. It works subtly but very effectively to plump up your skin and increase the collagen, increase your own collagen. And she thought it would be a good fit for me.
The 3 parts of facial skin rejuvenation are resurfacing, revolumizing, and protecting. For men and women who come in and they aren't exactly sure what they want or need, but they know that they don't look like they used to, and they would like to look the best they can for their age, it's very overwhelming to try to sort through everything that's thrown at today's patients. So I try to divide it into 3 categories. And this is what I tell people when we're trying to decide a treatment plan. I tell them that first, you need to resurface. And what that means is we need to get any precancerous tissue off your skin. We need to exfoliate. We need to possibly do a chemical peel, start a treatment regimen with either over-the-counter or prescription products, or maybe even do a laser procedure. The second part of looking the best for your age is revolumizing. If you really look at why we look older as we age, it's because the bone and soft tissue in your skin resorbs. So your skin stretches because of sun damage, and the struts that hold your skin up, like the soft tissue, muscles, and bone, all shrink or weaken. So to obtain that more youthful look, you have to replace the volume. And then the third thing is protection. And it's not that it's the third most important thing, but we used to think that 95% of our sun damage was done before we were 18 years of age. And in fact, now we know from newer and better literature that you do an equal amount of damage to your skin your entire life. So that if you are 50 and think that it's too late to protect your skin from the sun or the elements, then that's wrong. It's just like quitting smoking. If you quit baking in the sun, you can undo the damage, and it's not a worthless use of time, no matter what age you are, to start using sunscreen and sun protection. To sum it up, it's you want to resurface, revolumize, and protect.